There are calls for HIV-positive women who were sterilized in public hospitals without their consent to hand over the names of the doctors who abused their oath. Now, yesterday, the Commission for Gender Equality recommended countrywide investigations after confirming at least 37 cases of forced sterilization in Gauteng and in KwaZulu-Natal. For more on this, I'm joined now in the studio by Dr. Kgosi Letlape, President of the Health Professional Council of South Africa. Doc, it's good to have you with us.
Good afternoon to you and the viewers.
We had the Commission for Gender Equality here yesterday. Some shocking revelations coming out of the report of the conduct and the practice of doctors in these 15 or so hospitals that were investigated. In one instance, it's reported that a doctor said to the patient, "You have contracted tuberculosis, so we are going to have to sterilize you to prevent your kids from getting the disease." Is such a practice, I mean, even allowed from doctors?
No, those practices are not allowed medically. That would be an ethical practice to obtain consent under false pretenses. And no one should be coerced into an elective procedure they do not want.
Now, in terms of processes and protocols and how something of this nature should have been done, how are patients supposed to be given that right actually to make the choice?
I think what is extremely concerning is to add an elective procedure in the midst of something that is medically necessary when you are going to deliver and you are in labor. We can't bring other issues. So issues for sterilization are issues that need to be properly discussed prior to the procedure being done. There should be proper counseling. And going forward, as recommended by the Commission, we will expect practitioners to counsel patients before such a procedure and to also offer post-procedure counseling as well.
Yeah. Cases of this nature, have they ever been brought to your attention as they
not to my knowledge, not to my knowledge. But we must also be mindful of the fact that even when the Commission was investigating, there were great difficulties finding files, finding records. But I think what is more important for us is we need to work together to ensure that this doesn't happen ever again.
What sort of action would certainly follow? I mean, if indeed patients were to come forward, name a doctor, and of course report such an incident to you?
The action that will follow is that once a complaint has been raised, we will investigate the matter, and if it is felt that the doctor needs to answer, the doctor will be asked to provide an answer. And if the matter is of a serious nature, it will proceed to preliminary inquiry and to conduct inquiry, and there will be a full hearing and all sides will be heard. And peers will preside over the matter and decide as to whether there's any guilt or not and what course of action should be taken.
Yeah. And yourself as the Health Professions Council of South Africa, you were invited by the Commission for Gender Equality to come and sit in at the launch of this particular report. What were the questions that arose from you? And firstly, were you satisfied with the way in which the investigation was conducted?
We can't fault what the Gender Commission did, and we've got to commend them to come into the rescue of vulnerable women. Remember that this practice was performed on African women that are HIV positive, most of whom come from poor socioeconomic backgrounds. So these are vulnerable members of society whose rights as human beings were seriously violated.
Yeah. And when a health professional says to a patient, you HIV people, and these are the words that are coming out of the report, you don't think before giving birth to children, you must just be cut off. I mean, it's for me, I do not understand what would be getting into the mind of a professional.
What people have to understand is that this notion of population control pre-existed HIV times. And people were being told even before about having too many babies and needing for their own safety to be sterilized. So this matter needs to be thoroughly and properly investigated so that a context should be given, the historical context of where it comes from should be given. Not to excuse it, but to eradicate it.
Yeah.
And part of what needs to happen is that we need to properly educate practitioners about the rights of patients, but also responsible communication with patients. We also have a duty to ensure that where practitioners work, it's an enabling environment to ethical practice. One of the key issues that came up around this matter is the lack of informed consent. And we need to create an environment where practitioners have time to explain to their patients so that we have informed consent. So there are major issues that come up, not just the issue of the conduct of the practitioners, but the issue of the system of health for vulnerable population.
Right. Let's talk about that, because one of the recommendations from the Commission is that there needs to be a conversation that is had with the Minister of Health, particularly around the system itself, and an overhaul to the system, but also a look at the consent form and the wording in the consent form itself that needs to be redrafted and revisited.
Yeah, and I think, part of my concern is the South African mentality of looking for scapegoats instead of looking at the root cause of a problem. This is a system problem. And all of us as South Africans should be asking ourselves, do we live in a country where fellow citizens could be treated in this manner? What type of system are they being subjected to? Why are we not having solidarity with vulnerable citizens? And maybe at a broader level, when people ask themselves whether they support one health system as the NHI proposes, they should be mindful of what happens to vulnerable people that sit in a separate system. And you see, for me, I have this thing that haunts me, where you have a system where people have a common name called Next. When you sit in a system where when you come for services and you are vulnerable, the way you get called is next. You know that there's a challenge in that system. Where people are not identifiable. People don't have names. You are not Miss So-and-so or Mr. So-and-so. You are next.
Right.
And that is what the new South Africa has presented. Right. And we need to stand up so that we have a system that is safe, even for the vulnerable, that may not be able to speak eloquently for themselves.
No, absolutely. And I mean, I think you've also already answered that question. Is it proper and correct to expect the vulnerable, the poor, and in most instances also uneducated, to be the ones who are almost custodians of their own rights, to say, well, if I'm not treated properly, I am the one who is blamed, to say, no, you should have known your rights, you should have known to request it, you should have known to actually hold that doctor accountable?
Yeah, we have a system that is breaking down. And what people might not realize is that this challenge is not just for vulnerable patients. Even for people that are suited like yourself, that have medical aid, they get into a consult and they come out and they wonder what happened. They've not been properly consulted about a diagnosis that they've been given. They've not been given time to thoroughly process. The way the private system functions as well is such that you have people that have to give consent when they're already on a theater trolley in theater. We have systems that have been changed. When I grew up, you'd be admitted the day before. You'd have the anesthetist come and speak to you. You'd have your surgeon come and speak to you. You'd have the nurses be able to interpret if there's a communication issue. But there'd be a night over. Your relatives would be there to support you. But we now have systems that are geared towards money, where people come in the morning and they go out that same day for procedures.
And if you want a night over, you're going to have to pay for it.
You have to pay for it. The issue of an inability to communicate, the issue of where what we do is no longer health care, it's health provision, because the care component is fastly disappearing from the services that we provide.
Dr. Letlape, I appreciate your time. Thanks for coming through.
Thank you very much.
That is Dr. Kgosi Letlape, President of the Health Professionals Council of South Africa. They are calling, of course, for action to be taken against such doctors, as reported by the Commission of Gender Equality, who coerce and force patients to actually undergo sterilization.